Joining me now is a public health advocate, Dr. Yemisi Soyombo, who will be talking more on the continued rise of infections and increase in number of testing facilities. Thank you for joining us on TVC News at 10. Now, Nigeria is a country of about 200 million people, and for that population, as at 10 p.m. Tonight, the country has only been able to test 27,078 cases. That's less than 1% of the entire population. As a public health advocate, what do you say?
Thank you for having me. Good evening. I'd like to say that more testing locations are welcome because more testing locations will lead to proper tracing. Proper tracing will lead to proper management. I think that more testing locations are welcome. Then talking about the fact that it seems like there's a rise in the population of people who have been confirmed. I think looking at what has happened, looking at our socioeconomic factors, looking at the fact that there's an ease in the lockdown is pretty much expected, especially with the fact that a lot of people are still not sticking to being responsible for themselves. Adherence to the laws, adherence to social distancing, adherence to public personal hygiene. Some people don't also believe that it's still real. I like to say that COVID-19 is real. I like to commend the government for, especially in Lagos, where they have gone into communities, they have empowered primary health care centers, because, like we all know, there are people who are asymptomatic. So being asymptomatic is actually dangerous to society. What that means is that someone might be working close to you or beside you, and if you don't still adhere to those laws or adhere to those protocols, you could also contract the virus because some people are asymptomatic. So, I mean, more testing locations are welcome. I would wish and I would pray that the government can still go further than what they've done now. I also like to commend the fact that we now have hotels, isolation hotels. These are spaces and facilities or buildings that private people have contributed to this whole COVID menace. So what is happening now, what I'm sure of, is the fact that now there are more better measures to manage COVID-19 as it is, and I see that we're progressing.
Indeed, we're seeing many more people support government effort to actually flatten the curve of infection. Earlier, you alluded to the fact that citizens are not being as responsible as we should be at this time. So what would you suggest? A return to total lockdown?
I mean, we have to be look at what our own factors are, look at our own economy. I won't say we should, I won't authoritatively say we should go back to a total lockdown because of the economic factors that are staring or glaring at us. So I would rather say that we have to be more responsible. If there needs to be more sensitization, if there needs to be more community effort, we all have to be more responsible. If we can see and we feel that a total lockdown is going to affect us negatively, economically, we just have to be more responsible. We just have to wash our hands. We just have to stick to the social distancing and every other protocol that the health facilities, the health authorities are bringing our way. We have to be, everybody has to be responsible as it is right now.
All right, Dr. Soyombo, the policy of the NCDC is that someone has to show symptoms before a sample is collected from that individual for test to know whether or not the person has the virus. With the rise in cases of asymptomatic cases, do you still think that's the way to go?
I wouldn't say that's the way to go because testing is important. Whether asymptomatic or symptomatic, we need to confirm, and that's a way forward to management. So I would rather suggest that whether asymptomatic, whether not symptomatic, is a good practice to make sure everybody can be tested. Yeah, that's what I would rather advise.
All right. And the thing is, the more tests we conduct, the more cases we can actually confirm. Dr. Yemisi Soyombo is a public health advocate. Thank you for talking to us at this time.